So PHIG is a really unique set of funding that comes to us non-disease specific, right? Wide ranging. So when we got the notification that PHIG was on the way, we really met and we spent a long time thinking about how can we maximize this funding? What can we do to really fix our infrastructure? That's why it's in the title of the grant, right? In the state of Missouri, we have 115 local public health agencies. We're a decentralized system. So I like to say we're a big sister, little sister relationship. The more we can do to encourage those partnerships with the locals and their accountability with them, the better. And accreditation is the way to do that. And it's that framework to get you there. And so you really have a real strategic plan. You're using performance management for real impactful things. You're focusing on quality improvement. So with the tenets of transformation, if you can achieve accreditation, you know your operations are up to snuff. If you can focus on your workforce through accreditation as well, you know your people are happy. We want to elevate all of the public health jurisdictions in the state of Missouri to that level of excellence, and accreditation is the key. When we wrote our PHIG application, we made sure we had a diverse set of ways to support locals on their accreditation journeys. So we knew we couldn't tie everything to straight up achieving accreditation because that is a very far away dream for a few of our jurisdictions. So we tied it to making progress on your journey. You may not be accredited next year, but you've got this like North Star of a plan that you know what you're gonna do for your folks now. So that is a net positive for public health. At the state level, we decided to address those barriers with cost reimbursement funding that you can use to hire or pay for staff time, contract out to get some of those big, scary things done for accreditation. And then we made sure folks had access to the training and the readiness assessment from PHAB at no cost. We even tied some of our general revenue incentive payments to engaging in that offering, so our locals could get the training, the one-on-one coaching, the recommendations, and take the readiness assessment while making money. So we tried to kind of incentivize that, remove the barriers of people, time, and money through the support from the state. So one of the big barriers towards accreditation is the cost associated with contracting out, if you choose to, spending the staff time to make it happen. So we knew that that was one of the big ones that we need to address through PHIG support. So we had those 10 jurisdictions that were already accredited. We want to make sure they maintain their accreditation. And we thought, you know, with this kind of support, maybe 1 or 2 locals will get there for us. But we're in year 3 now, and with $50 million distributed in cost reimbursement over 2 years to 50 jurisdictions in our state out of 115. That's pretty great that many actually are interested and put in budgets and were granted that support. And through our readiness assessment contract with PHAB and the incentive dollars tied to that, we've had over 80% of our local public health agencies have engaged in that offering. So that is progress towards accreditation. That is them learning about pathways, learning about could they go ahead and go for accreditation? Are they ready? And with the recent readiness assessment for reaccreditation, that engages those 10 that were already on their games to make sure that the entire population is involved. Very proud of Michelle, shout out Michelle in Carter County. They recently completed their site visit for the first time ever for accreditation with PHAB, and it was in person. Michelle really is tenacious, and she took advantage of the support that we have out there. She is part of our technical assistance cohorts. I see emails from her asking, like, how'd y'all do this weekly? So she's a great example of a health department that is so under-resourced. She has 5 FTE in her agency and probably 4,000 people in her county. So tiny, but what they did, they took advantage of the support options. She threw herself into this, she learned it, she did it, and she is my shining example of anyone can do this if you have the chutzpah and you have the energy and the support there to do it. So engage in the resources there and you can get there. So I will be bragging about Carter County for the rest of my life. We're able to be more flexible with PHIG funding because it is so wide-ranging. So if folks are doubting the effectiveness of the PHIG dollars, I want them to look around at their local agencies and their state agencies and see the amazing work that's being done with this money. So I firmly believe the more money that you put into public health, the better the folks that live in your jurisdiction are, right? Some of the things we rattle off in Missouri is if you want to reduce Medicaid spending, did you know that $1 in public health spending saves 7 in Medicaid spending? So we need to always have those talking points out and ready, and we need to have this kind of funding that lets us put it where we most need it to build that system up rather than having our siloed little programs like we've always done.